Hi, my name is Andrea Johnson. As a mother, I often think of the huge responsibility entrusted in me to keep my children safe in a world full of uncertainty, changes, differences. It is my duty as their mother to provide them with a safe environment to grow, develop, and thrive, as well as to provide them with tools to tackle the world on their own. Sound familiar? Maybe perhaps because as nurses, we are often doing the same thing. For our patients, they entrust their lives to us, their health, their well being. This brings me to the Chasing Zero video we were assigned to watch. This video not only brought tears to my eyes, but also fed my sense of responsibility towards ensuring the safety of all of my patients. A very important takeaway point from this video is that in order to win the war against healthcare harm, we have to be willing to work as a team. Not only do we have to be mindful about our own involvement in safety implementation of our patients' care, but also bring awareness to the people around us, as well as bring accountability to the co-workers in the healthcare team. While listening to some of the examples provided in the video, I am very fortunate to say that I have not personally, as a nurse, encountered any issues with safety or patients' harm during my practice. I can think of a few examples, though, in the ICU setting. The implementation of heparin drips without close monitoring of blood levels to check coagulation status could be a potential harmful, deadly mistake. Also, the development of pressure ulcers in an ICU setting, highly likely if nurses or aides fail to care to turn the patients at an adequate time or to provide measures and implement measures to prevent pressure ulcers. Also, the administration of insulin without co-signing. You have to have an extra pair of hands, an extra pair of eyes to be able to check and double check the administration of insulin. One of the things that I have noticed in our hospital setting with COVID-19, we have become a little bit more relaxed with scanning the medications because of being in an isolation room. The computers that we're often taking into the patient's rooms to do this scanning are no longer able to go into the patient's room that are in isolation. So this prevents from the scanning procedures to take place. This creates a huge bridge and risk when giving medications to patients without having the extra technology to help lay eyes and assist us with the checking and double checking of that medication. So it is very important to say that regardless of a pandemic, regardless of isolation status, regardless of anything, it is the nurse's responsibility to create an environment of safety, implementing measures to prevent patients' harm. Thank you.